Okay, everybody, welcome, welcome. Welcome to the call tonight. So our call tonight is going to be from a nurse's perspective. My name is Andrea Laplante. I'm a national marketing director with the JuicePlus company, but I am also a certified health coach with the Dr. Sears Wellness Institute, and I am a mom of 3. And my journey started with nutrition when my son, I have 3 children, my middle guy overdosed on isolated vitamin supplements, which was a huge wake-up call for me and my family. I was angry, I was confused, I was looking for answers, and I was really, really looking for education and trying to figure out a way to nourish my family nutritionally, not from an isolated vitamin supplement that obviously didn't work in my family. So I went out on my own and just started researching and trying to figure out what the best way to nourish my family was, chopping and slicing as much as I could. And one day I went into my gym and I saw this, and it was plant powders, whole food nutrition, not an isolated vitamin supplement. The first thing I did was look at the back of the bottle, and I saw no child warning label, no poison control number, no child safety log. That this was fruits, vegetables, and berries grown vine ripened, which is unlike anything at a store, that is now shipped and picked 1,500 miles, and there's a lot of chemicals and contaminants we have to worry about, and our food supply is now depleted just because society has evolved, but our food supply has really taken a hit. So when I saw this JuicePlus plant powders, I was wondering, well, how are they doing the testing? And that's where this NSF comes in, National Sanitation Foundation, and the plants are cleaned after they're dehydrated. They're tested for herbicides, pesticides, molds, mildews, heavy metals. It's backed in science, 25 years, clinical research, and the NSF label is just really the way to go in terms of making sure your food is clean and safe. We added it to our diet. It's been 7 years, no meds, no copays, no only well visits for my family of 5, no antibiotics, no side effects to worry about. It's just been really nourishing our family. So I would love to share with you the background of these nurses that I've shared this nutrition with, and they have now decided to incorporate it into their diet, and also to get the background of their why they value this nutrition from a health standpoint, what they have seen in the healthcare industry with the years of being a nurse, and why they have decided to partner with this company as well and share it. And I'm so excited. I'm so excited to introduce them. But first, I'm just going to tell you how the call is going to be structured. First, I'm going to ask each of them to answer these 3 questions. Number 1, the first question is, why did you all decide to become nurses? The second question will be, what changes have you seen in the healthcare industry from the start of your nursing career until now? And number 3 is, why did this nutrition and company make sense to you? How have you benefited from it, and why have you decided to share it and partner with this company? This is incredible. I have a list here. Just bear with me of the background of all these 3 incredible women. And I'd just like to read this off just to show you how valuable it is to hear from each of them. Sue Ryan graduated in 1987 from the University of Vermont. She worked at Beth Israel Hospital in Boston on both neuromed, surgical floor, and post-anesthesia care. She completed a master's at BC in 1995, worked as an adult nurse practitioner, now clinical supervisor at Middlesex Community College, where she today is an adjunct faculty member. She also works per diem at Beth Israel at the GI unit, and also by contract for Teva Pharmaceuticals, and she is a sales coordinator with the JuicePlus company. Now, Dee Powers, and then I will go after and I will introduce Sue, and they will pass the call to each other. But I'm just going to read the backgrounds now, so we don't have to interrupt them talking. Dee Powers has been a nurse for 44 years and a geriatric nurse practitioner for 12 years, an adjunct faculty member at Middlesex Community College RN nursing program for 23 years. She's a JuicePlus taker, believer, and advocate, and she is a direct distributor with the JuicePlus company. Mary Principe has been a nurse for 54 years, has a background in nursing for 54 years. Can you believe this? All of the years of these women in the healthcare industry. It's such an honor to be able to introduce you tonight. She started in 1965 after graduating Worcester City Hospital, worked in medical surgery, then 10 years with Worcester City Visiting Nurse Association as a staff nurse, then director of the Community Care Connection program. She left the VNA to accept a position as the director of an adult day health program, elected president of the Mass Adult Day Health Association, worked as a long-term care underwriter at John Hancock, then admissions director at a skilled nursing facility, a nurse liaison at a private duty nursing company on Cape Cod, and now recently certified as a health coach for the Dr. Sears Wellness Institute for Families and Primetime Health. And she is also a sales coordinator at the JuicePlus company. So I'm honored, and it's a privilege. I have chills, bumps on my arms, just to be able to introduce you all, and just from the bottom of my heart, just so grateful to you and everything that you've done in the community and the healthcare system, and just want to honor you tonight. And I'm really excited to hear your story. So Sue, I'd love it if you'd go first.
All right, so first I do have to apologize for my, oh my goodness, my laryngitis. I have not had a cold in 3 years. And this is the first time that I've had any little bit of a cold, and of course it settled right in my throat. So I'm gonna sound a little bit like a teenage boy. Does that sound okay? Is that all right? Okay. All right, so thank you, Andrea, for organizing this Nurses Perspective call. Nursing is such an important part of the healthcare team, and often we do not let our voices be heard. So having the three of us here with all these years of experience is just phenomenal. I'm humbled to be here with these two wonderful clinicians and educators, and both of these women I've worked with for a number of years now in the JuicePlus business, so this is just great. So why I decided to become a nurse was actually kind of ironic, because I really did not have any sense of being a nurse growing up. Wasn't part of my thought process growing up. My mom was a healthcare administrator and was someone who wished she'd been a nurse. It would have been a great adjunct to her career to be an RN, but I did not want a part of that blood and needles, anything to do with that. But luckily, a friend of mine who was working as a nurse's aide in a nursing home suggested to me that there was a position as a bed maker. And I thought, you know, making some beds on the weekend was safe enough, so I took that job. And what I found was going from room to room, talking with the residents, learning about their past, talking with them about their worries, their concerns, their families, their joys. It really started to teach me about what the core of nursing was really all about. So when the job became available for a nurse's aide, that was my next step into helping people more with their physical needs, with their hygiene and their meals, and comfort and rest. And that was really where my passion for nursing really grew. So when it became time to go on to my future, that was when I decided to go to UVM for nursing education. So really, I have 3 areas where I've noticed changes in the area of healthcare from 1987 to now. And what the most astounding thing that I see when I walk into any healthcare facility or any doctor's office is technology. Anywhere you go, you're going to see computers, you're going to see non-invasive equipment to use. And to me, this is kind of turning healthcare in general into a hands-off rather than a hands-on profession. We have computer documentation, which of course has been wonderful and helped us in so many ways. But often you find that the face of the clinician is in the computer tapping away, writing a note while they're talking to the patient, who sometimes is sitting off to the side. And they're not looking at the response to the questions and looking at their reaction to the things that they're talking about. And you can lose a lot of the nuances in what's happening with a person and what they're saying and what is really going on in their life and their situation. So as much as we need to use this update and this technology, we also need to be really careful to not let it take over. We don't want our patients to become a series of checklists of they have this symptom, that symptom, this is normal, that is normal. We want to look at what the description is and the particulars of what every individual has and what that means for that particular person and what those changes are that are occurring over time for each person. Secondly, what I see, which has really stood out to me, especially since I've been in the field of neurology since first getting out of college, is I can use stroke as my example, is the age at which people are suffering from certain illnesses. When I was first on the neuromedical floor at Beth Israel Hospital, the average age group population for people suffering from a stroke was between 70 to 90 years old. And these people were retired, they had adult children and grandchildren. And now, when I take students to an acute rehab hospital, the average age of patients ranges much younger. Just this week, we had 25% of the patients on the floor were under the age of 65. Patients are 50 years old and they have chronic illnesses. They've been suffering with hypertension, hyperlipidemia, high cholesterol, diabetes, and all of these conditions are leading to them to have a stroke. And these are people in the prime of their lives. They have young children living in their homes. They are in the midst of their jobs. They are often taking care of their older parents. And they are from choices of from having poor nutrition and lack of exercise, poor stress management, and smoking, are getting illnesses much younger and suffering the consequences of these chronic illnesses. Yes, some of this is genetic, but a lot of it is just the poor American standard diet and the choices that we're all making and where healthcare has gone. Which leads me to my third issue with healthcare, is that I find that we're spending much less time with people during our visits. When I was training as a nurse practitioner, I felt like the office that I trained in was just a revolving door of patients and prescriptions, with get them in, get them out, quickly as we possibly could. And it was just send them home with a prescription. They wanted a piece of paper, something that was going to fix their problem. And very little time was spent on health education. And in my mind, this showed very little respect for patients and very little, just not giving them the time to give them information about the process that was going on and what they could do to control these issues and empower them to take control over the problems that were going on. They need to sit with them and talk with them and give them more information and education, and at least attempt to help them understand what was happening and what they could do to better stay healthy. My greatest example of this is a recent situation we've had with my sister-in-law, who was recently diagnosed with a meningioma, which is a type of brain tumor, which luckily is a benign type of brain tumor. But she did need to have surgery to have it removed. She had radiation treatments, and it is a type of brain tumor that can grow back. So she'll have MRIs every 3 to 6 months to watch for this regrowth. And so I asked her, in the meantime, what are your doctors suggesting to you that you do in the meantime to keep yourself healthy and as time goes forward? And she kind of looked at me like, dumbfounded. What do you mean? Like, what would I do? I'm just waiting till I go for my next MRI. And I was dumbfounded by this. I thought, what? Here she has this ticking time bomb in her head of abnormal brain cells just waiting to proliferate, and no one suggested to her healthy nutrition, omega fatty acids, lifestyle. They didn't give anything for her to do that she could empower her to stay healthy and create a great healthy living environment for her body to fight against this cancer that she could prevent from taking over in her body. Which leads me to why this nutrition in this company makes so much sense to me. I know that technology and pharmaceuticals have their place in healthcare, but so much of disease and illness can be helped and prevented with comprehensive whole food nutrition, consumed consistently every single day. When I'm with people in the JuicePlus company, I feel like I'm speaking the same language. I'm with people who understand that simple, basic, easy. It just makes sense. For me, my JuicePlus story started about 3 years ago. It was just about April in 2016. I ran into a friend of mine. It was someone that I'd known for a long time, but this time when I saw her, I thought, what are you doing? There's something totally different about you. There was a presence about her. Her eyes were bright, her hair was shining, and I just said, what are you doing? I need what you have. And she told me about JuicePlus. And I thought, 30 fruits and vegetables and berries and capsules, how simple. 15 more in 15 more plants and ancient grains in the complete shake. I wanted this. This would make total sense to me. At that time, I'd been reading more about plants and going towards a plant-based diet and watching all the documentaries about the standard American diet and the torture that we were putting our bodies through with all these processed foods. And I knew that I had been trying to eat well, but I also suffered the pitfalls of what was out there and what was easy and what was just easy to access and put in the poor eating habits that I had. So I thought this was perfect. It would be the perfect adjunct to healthy daily nutrition. And that was the key, just daily getting this nutrition without a miss. So without expecting much more than the knowledge that I'd be getting this excellent daily nutrition, I signed on and started swallowing my 6 capsules, and I was drinking usually 1 to 2 shakes a day. And I noticed in a very short time that my energy was feeling much better. I was having no longer having those afternoon crashes. I wasn't driving home from work with my heavy eyelids, just wanting to getting onto that couch and take a nap. What else was amazing was that I was waking up before my 5 a.m. alarm. I would wake up and feel like I was ready for the day. I wasn't thinking about getting back into bed and needing more rest time. And really, if that was all that happened for me, I would have been thrilled. I was just so glad that I had more time in my day to feel energy, have time for projects and work and things to do in the afternoon. But what I also noticed was my hair, my skin, my nails, my gums weren't bleeding, and also the aches and pains, just aches after a workout, or my knees had always been kind of the bane of my existence. I always felt that sort of twinge every time I would stand up after sitting for a long time or going down the stairs. And it was about 3 months after starting JuicePlus. I thought, I'm not even noticing that I feel any aches or pains anymore, which at 54 on Saturday is a very good thing. So I then knew that this was just something that I was going to have to share. I was telling everybody about it as it was, and I thought, this was going to be good for everybody that I knew, whether they had any kind of sequelae, any kind of illness, disease process, autoimmune deficiency, or just for everyday living. People who are getting all their fruits and vegetables every day anyways, great. You need more anyhow. So I started sharing with everybody that I knew. I wanted to put my nursing credentials to this education as well. Nursing is educating, and it is my responsibility to share this information. One of the greatest joys in my profession is that I get to see people get healthier and to live their life to the fullest. And to be a part of that process is amazing. People will often come to me with questions about their health and about a specific illness that they have. Behavior changes are one of the hardest changes to make. You are trying to take something and change a very well-established routine, something that's really comfortable. And it's this JuicePlus gives me a tool to say, you want to start adding more fruits and vegetables into your life, but try this product, try this. This is something very simple. Swallow these capsules, chew these gummies, take a shake, and your palate will start to change. But it gives people something to use in their daily life to start making those changes and feel they have some control over their health. I educate people to see that we do not want to use the healthcare system as a source to go to be fixed. I want to show people that they have control and empower them to see that they can start making those positive changes right away towards better health. That's another reason why I love this JuicePlus community so much. We have, as soon as we introduce people into our community, we have the Project Health page on our website that has tips for recipes and stress reduction and exercise ideas. All of these recordings that we have for everyone, from professionals of all array of backgrounds for any kind of issue that people might be needing. There's something for everyone, and there's a resource that we can tap people into. There's no lack of support for people from this company. I have no lack of confidence in recommending this product with all of the research that we have going on. This product can be taken, as Andrea mentioned before, from anyone from a pregnant or nursing mother to the elderly. There's no warning labels. It's NSF certified. We have all of the research going on. I just want to point out too, there was an article in Time magazine last month. I would recommend everyone read it. It's called Why Food Could Be the Best Medicine of All. And one of the things that struck me about this article was it started talking about if only we could do research on blueberries, a cup of blueberries. But we really can't do things like that. And I thought, we have. JuicePlus has done that research. We have so many, we have 38 and counting research articles on this kind of, on food in humans. So we have the gold standard research. It's something very exciting, and clearly you can see I'm passionate about. One of the saddest things for me is to see people missing out on life because of poor health. As I said, this is the first cold I've had, and my birthday is Saturday, and I better be over this cold by then. Because whether you're missing out on something like a birthday celebration because of a cold or a flu, or you have to cancel, I've seen people miss out on wedding celebrations because of an exacerbation of symptoms from chronic illness. You don't want to do that. You don't want to miss those things. You want to stay healthy. And I've seen the changes in people's health status once they've started taking JuicePlus. I've celebrated with them when they've seen the improved lab results in their health, and I've high-fived them when they've had that workout or completed that 5K that they didn't think they were going to be able to do. The other thing that's most significant to me is that educating people that the lack of a symptom is just as important as seeing a symptom go away. That if you are not getting that cold, you're not experiencing that high blood pressure, you don't get that diagnosis of cancer. Those are other things that I rejoice. That's where the real education needs to come in with people, teaching them that the good nutrition and not getting sick is where it's really all at. So helping people understand that JuicePlus is really about being an insurance policy. It's just over $2 a day, and that gives me the reassurance that I am nourishing my body with the nutrients it needs to regenerate all the healthy cells I have and to stay strong. So being a nurse is about helping people be their best self, listening to them, their concerns, meeting them where they are on their journey, on their health journey. JuicePlus can meet anyone along the way, wherever they are, to give them the control they need to improve their health. My hope is that when we talk about the changes in healthcare in the near future, that we're talking about how we've incorporated whole nutrition into a daily prescription. And I know that this is something that I will always take myself every single day, and that I'll keep recommending to everyone that I know. Thank you. I'll hand it over to Dee.
I'm with you, Sue. That's excellent. Great job. Hello, everybody. Is it okay if I go ahead, Andrea? I want to thank Andrea especially for having me join this esteemed group of professionals. I'm honored to speak on behalf of nursing and JuicePlus Nutrition. What I have to remind myself is that in my era of the 1970s, when I went to nursing school, women became either nurses or they became teachers. Those were the choices, or possibly maybe a clerical job, as my mom did in her generation, and she's now 95. I did work as a CNA, a nursing assistant, in the summers when I was in my Bachelor of Science nursing program up in Maine. It was a natural fit for me, though, nursing turned out to be. I'm a people person, first and foremost, and always felt at ease in that caregiving role. It's also a profession, though, that opens many doors and different paths to follow while raising a family. And again, back in the 70s and 80s, that was really a key piece, that most women remained home. And nursing allowed me to have a job that complemented my husband's, because we have 3 children. We never needed babysitters. I worked an off shift. He'd come home and I'd go out, and that's how we did it. And, it was just us, always just us, I said. But nursing allows for that flexibility. My initial work when I graduated from nursing school was at Cambridge City Hospital on the floors, the medical surgical floor, and then I worked in the intensive care unit for a year. But then I moved out to the community and became a visiting nurse. Sounds like Mary did that as well. I was a visiting nurse for 20 years. And I think that's where my passion for seeing the complete person came to be, and especially working with older adults, because probably 60 to 70% of the patients in the community are over the age of 60. So I became like their general practitioner and managing all aspects of their care, including the families of the clients, which is really important to note as a nurse, that you can't just treat the patient, you treat the entire family. This was also where I saw a critical need for educating patients and families about the importance of nutrition as a central component of better health. Nutrition education, as well as teaching clients about their disease or medical conditions, though, takes time. It always takes time. And what do we not have much of? We don't have a lot of time. It's always about the numbers, the number of patients you see. Even, I'll never forget my boss when I was a visiting nurse. She would actually say to me, Dee, could you see a couple of extra patients today? I have 6. She goes, could you see 8? I said, no, because then it would take time away from the patients that I did have. They would give you extra money if you saw extra patients. But education was always in my heart of hearts, one of my passions. It's easy to give just somebody another medication, but incorporating lifestyle changes and good nutrition is much more challenging, as the client must be disciplined, though, to take ownership of their own health. That's the hardest piece. They always want a quick fix, but good health does not happen overnight. It takes daily nutrition, daily exercise, and relieving the stress, which is very, very hard for most families today. But I would take that time to educate my clients and the families, which in the end made every difference in overall health outcomes. As our children got older, I felt the need to advance my career in order to teach nursing students, and I became an adult and gerontological nurse practitioner, and that was what I've been able to do over the past 2 decades. Most providers, as Sue alluded to, rarely have the time to do any education in a 15-minute block. Again, seeing mostly older adult clients, if I had 15 minutes, my poor older adults would take half of that time just to get down to my exam room, and they need more time than anybody. And again, you might have someone that's having a panic attack, thinks they're having a heart attack. You can't just fix that with a quick, yes, here, take this pill. So education is at the core of everything that I believe nurses do best. But again, it was in the past several years that I became even more aware of nutritional impact at the cellular level. My daughter, I'm going to share with you a couple of anecdotal stories. My daughter, who's been an actress in New York for 15 years, it requires tremendous energy to get to several auditions in a day while performing 8 shows a week. 8 shows a week. She was also diagnosed with celiac disease 11 years ago, which made her take a much closer look at her nutrition. She started to incorporate juicing into her daily routine to provide the nutrients that she needed to not just survive, but to stay healthy. Juicing, as you know, is a way to get a mixture of fruits and vegetables that are typically in a liquid form that allow nutrients to be absorbed more easily. However, the process, as Sue also said, is very messy and very, very time consuming. Now you can buy juices, which can also be quite expensive. But it became a part of her regular routine to stay healthy, which she did. My son also had a condition called Raynaud's disease. He's my second child. And Raynaud's is an autoimmune condition that causes the hands and feet to turn white with cold exposure, and the blood vessels actually vasoconstrict. So my daughter got him into juicing several years ago and found that his Raynaud's actually completely resolved after incorporating juicing 4 to 5 times a week. But once again, what a lot of work. Juicing provides many micronutrient and antioxidants which help to mediate the immune response. But for him, it worked. But we had to find something simpler because my son and my daughter then in turn both got married and have children. So when one of my colleagues, and her name happens to be Sue Ryan, introduced me to JuicePlus and explained the process by which it is made from whole food nutrition and is NSF certified, I jumped on it. She didn't need to explain much to me. As a scientist, as a nurse, fundamentally, I knew right away this was for me and my family. I had no hesitation. I was able to give both my son and my daughter JuicePlus as a gift with remarkable results for both of them. And again, because they have children, they were also able to become a part of the Children's Health Study, which is Healthy Starts, and children at the age of 4 and up, between ages 4 and 18, can have fruits and vegetables in a gummy or capsule form for free with one adult subscriber. So I thought this was awesome when we were able to get the children involved. What a great way to start a young life. So again, with children, as we know, lives are hectic and stress-filled, and nutrition is fundamental. To consume the US dietary guidelines of 2.5 to even 3 cups of fruits and vegetables a day, the intent is there, but the reality is rarely able to be taken care of. You are not able to actually fulfill that with the way we live our daily lives, and that's what's really hard. They have been healthy, my daughter and son, over the past year with no long-standing infections. My sister, too, is also somebody I'd like to share her story. She's 72 years old and has had MS since she was 35, multiple sclerosis, and has a history of breast cancer. She had metastatic breast cancer 19 years ago. I actually had her start on JuicePlus over 2 years ago with only one cold in 2 years that has lasted only 3 days. Prior to JuicePlus, she would come back from her grandchildren's home after visiting them with bronchitis or pneumonia that lasted over 3 weeks, every single time. Now she goes to visit them, she comes home and just smiles. And she says, "No germs, Dee. I'm ready, I'm armed, I have what I need." I'm so grateful for JuicePlus. And her neurologist was very, very surprised that as each year went by with progression of her MS, he could not believe how well she was doing, how stable, and that she has remained strong. He said, "Kathy, whatever you're doing, keep it up because it's working." And she talked to him about JuicePlus and how her sister, who's a nurse and a nurse practitioner, highly recommended this. And he said, "Well, I'm going to have to look into it." That's what he said. So presently, she is now recovering from hip surgery. She's been through a lot, but is ahead of schedule. She's done remarkably well, has healed well. Her doctor is in awe because they expected Kathy to have all kinds of complications due to her MS on the affected side. But those helper T cells are supported by all the phytonutrients and antioxidants at the cellular level that JuicePlus gives us. How did I not know about this years ago? I say, how has this been around for 20, 25 years and I haven't known about it? So I just feel like it has been a gift that Sue introduced it to me, my family, my friends. I have many, many family and friends who look to me for health-related guidance. Nursing, as we all know, is the most trusted profession. It's been voted the most trusted profession for the last 15 years. So that's a great deal of responsibility that I have when my family, my friends come to me for advice because they trust me. Several of my family members and friends will say, "If you say this is good for me, Dee, this JuicePlus thing, then it must be, because I trust you with all my heart." It has been a gift to be a part of this company whose mission is to keep us healthy through whole food nutrition and all kinds of options with bars and shakes and the Tower Garden. I'm just hit the tip of the iceberg. I'm just beginning. I'm so impressed with the people that I get to work with. And I have such confidence because of its science-based research. That is not me saying it. It's all these other professionals and scientific researchers telling us that. But this allows us to be the best version of ourselves. JuicePlus will always be with me in my nursing, as an educator, a caregiver, and a provider. Because remember, oxidative stress is part of living every single day. And I have JuicePlus as my own personal army, I call it, to fight those free radicals. Remember, free radicals that contribute to disease, infection, and even cancer. So you must have a plan. And my plan is to try to do what I can control, and that's exercise and eat well to the best of my ability day to day. Sometimes that doesn't always work out so well. So JuicePlus with its fruits and vegetables, berry blend, and my omega fatty acids, which we are not able to produce by our own body. So you need that for vision and brain and heart health, especially. All of these things are part of my way of dealing with me being in my 7th decade. Aging is inevitable. We all know that. But you must regularly do what you can control, and find ways to fight it, not sit back and just take it. So I say with me, I'm ready. I'm ready because I have JuicePlus. Thanks, everybody.
So powerful. Mary, I'll hand it over to you to close out.
Okay, thank you, and thank you for inviting me to be part of this amazing group of nurses like myself. It's so empowering to listen to your stories because you came after me. I'm sort of the old girl here, but anyway, I do have a story. So one of the reasons, I'm going to start with the first question that Andrea wanted me to answer, which is why I decided to become a nurse. Actually, I kind of just fell into a nursing career. I was introduced to it in my senior year of high school and thought, okay, I could do that. In hindsight, I realized that my path was chosen for me. As a young girl, my grandmother was bedbound with severe rheumatoid arthritis. When I visited her, I often needed to assist with some activities of daily living, and it was just a natural thing for me to do. Also, in junior high, I worked summer camps helping children with cerebral palsy. Looking back on my journey, nursing was the career path that I was meant to follow. So I'd just like to share with you what changes I have seen in the past 54 years since I started my career as a nurse. First of all, things were much simpler then. MDs actually made home visits. When I was going into my first year of nursing school, my primary care doctor came to my house because I had bronchitis. Treatments were more holistic. Hospital patients were less sick, had less complications. Treatments were simpler. We did not have the wide variety of antibiotics or designer medications or high-tech options that are available today. We no longer have a healthcare management system. We have evolved now in 2019 into a disease management system driven by pharmacology companies, pharmaceuticals, and high technology treatments. Physician offices were more family-oriented, and doctors spent more time talking with their patients. And as Sue said, they were not sitting at a computer punching in answers. They were actually looking at you. I had an experience in my own life where I was seeing an allergist at one point, and I fired him because he came in every day, shook my hand, said, "Hi, how are you?" and then proceeded to sit with his behind me, ask me questions, and pump them into his computer. So I was like, I'm done with you, buddy. That's, to me, is too impersonal, and it was just about filling in all the dots for the insurance companies. Insurance companies, when I was first started in nursing, were less involved because physicians manage treatments and outcomes. Now insurance companies manage treatments and outcomes. MDs today have limited time to see people. There is more emphasis on drugs rather than the simple lifestyle changes such as exercise, attitudes, and food. So the third question that I'm going to respond to is, why did this company make sense to me? About 7 years ago, I was introduced to JuicePlus, and it made sense. I'm a nurse. I grew up with a mother who was from England. We ate lots of whole foods in our house. However, yes, we had lots of, there were, prior to this time, there was an onslaught. When I was growing up, there were lots of whole foods in our house. This was prior to the increase or onslaught of so many processed foods we now have. So 7 years ago or such, I attended a boot camp with JuicePlus so after studying on JuicePlus, because even though I understood the value of adding this to our diet, I'm sort of a skeptic. And until I had seen the research, I was still skeptical. But at this JuicePlus boot camp that I attended, Dr. Bill Sears presented his medicine bottle theory. This theory, in which he said all of our bodies have their own medicine bottles. And when we give our bodies the right nutrition, the right exercise, enough sleep, and enough water, our natural medicine bottles open up and flood our bodies with the nitric oxide that it needs to keep our cells healthy. So I knew our bodies needed whole foods, but this presentation was so profound. It was really an aha moment for me, and I jumped on board and wanted to share this with everyone I knew. How have I personally benefited from the whole food nutrition, and why do I share it? I benefited from adding JuicePlus to my diet in so many ways, and I'm so grateful that it came into my life, because I'm now 75, and 7 years ago, I was dealing with chronic issues. I virtually grew up with lung problems, chronic bronchitis, sinus infections that I suffered from since high school. As I said, I was entering nursing school when I had a home visit from my doctor because I had bronchitis. When I had my first baby, I had a severe bout of bronchitis, continued sinus infections, irritable bowel syndrome, and other digestive issues. However, since embracing JuicePlus and the lifestyle, doing a monthly shred, I've learned that what I thought was a result of natural eating turns out that I have a gluten issue. So I have no more bronchitis. I have no more sinus infections. I have not taken an antibiotic in years. I fly frequently because I'm retired. And when I flew years ago, I always had a sinus infection after flying. I don't experience that anymore. So grateful for this whole food nutrition, because it's given me my life back. Truly, as a retired person, I'm enjoying such a high quality of life. My energy level is off the charts. I have more energy than so many young people. And as a nurse, I've decided that I've seen the profound changes in health in all ages. The education provided by the JuicePlus company is so profound, yet so many people don't know about it. MDs and many other healthcare professionals do not understand the impact that this whole food plant product can have. I feel responsible as a healthcare professional to tell as many people as possible. I'm sharing it because everyone needs to know about JuicePlus and how it helps them to live a better quality of life and age well. When someone tells you how great they feel since starting JuicePlus, and my family and our quality of life is optimum, without this nutrition, we would not be doing what we were doing. Our energy level and lack of sickness days affords us a high quality of living. Also, when I see the increase in childhood obesity, childhood cardiovascular disease, increase in brain disease for all ages is the fastest growing disease problem facing America today. And that's a quote from Dr. Sears. Cardiovascular disease, cancer, and other inflammatory chronic health issues in young people who should be just enjoying life. I know I need to help others learn that there is an alternative, and that's why I share JuicePlus. I'd just like to thank you all for coming on this call tonight, and I'd like to just end with this one comment. Many years ago, when I was working as an adult day health director, I invited a priest to come and speak to my participants. And he said something so profound, I've never forgotten it. He said that because of technology, they've added years to our life, but not life to our years. And I truly believe that JuicePlus is giving us the opportunity to add life to our years. Thank you all for listening. Have a great evening.
Wow. What an amazing call. All of you, Sue Ryan, Dee Powers, Mary Principe. And I grew up, Mary's my mother. I grew up with my mother who's a nurse. So when you have a pioneer like that in your house that is a mentor, you can't but help fall in love with the education that this company provides and some of the stories you hear growing up. It just changes you as a kid. A lot of the stories that I heard about what people are going through. And I think that really motivates me to get out and share and make that kind of a difference as well. But you are all brilliant in your sharing tonight. Thank you so much for your time. We appreciate all our nurses. We love all our nurses. And just have a great night, everybody. And thank you all for coming and joining us and hearing this amazing education. Have a great night, everybody. Thank you.